Good morning. It is Thursday, July 15th. I'm Jessica Lovell. Welcome into the morning medical update. As usual, we are talking COVID-19, and then we're going to introduce you to a short health topic so that you at home have time to think up and then send in those questions. So today we are talking about something all of us should be using, but is it safe? Does sunscreen cause cancer or other potential illness? We look at the data and then answer your skin health questions. But first, let's get straight to our COVID count with Dr. Dana Hawkinson. Good morning to you.
Yeah.
The news isn't real good.
No, it's starting to be fairly concerning. We know it was very concerning down in southwest Missouri and Springfield. Up here in the metro area, starting to get concerning as well, with the number of cases certainly increased from a few weeks ago with the 7-day rolling average. But more concerning is the hospitalizations, and Dr. Stites has been talking about that as being the bellwether for the past few weeks. Right now in our hospital, we have 37 active infections, with 9 in the ICU and 4 on the ventilator. 6 of those patients are vaccinated, so 6 of the 37 are fully vaccinated. The rest of the people are not vaccinated. We should point out that those people that are vaccinated do have significant comorbidities. They have obesity, hematologic malignancy or cancer, other immunosuppression, heart disease, lung disease. So again, the vast majority of these people that are in the hospital right now, Jessica, are unvaccinated. It's a tragedy because this is so preventable.
It's the same story you keep telling us about the unvaccinated folks. Let's get to some reporter questions. If we have any on the line, go ahead. Okay, so I do have a couple of questions. Speaking of Springfield, and thank you to Harrison Keegan with News Leader for sending this in. He is curious about other hospitals in the area, like ours, Dr. Hawkinson, that are worried of similar surges in cases that might be coming to our community.
Yeah, I mean, just speaking in a broad stroke around the metro area hospitals, all of those hospitals are seeing an uptick in the number of cases in their facilities. Even 1 or 2 weeks prior to us having so many patients or seeing an increase in patients, there were a couple hospitals around our community that had seen an increase already. But certainly now that trend, what we are seeing, the trend continues to be seen in those other, neighbor hospitals around the metro.
All right, so Donna from KMBC has a question. With the rise in COVID cases recently, are you seeing any resentment or frustration in people who have gotten their shots and then now feel that they're in danger more now because of the people who have chosen not to get vaccinated? In light of that, what do you say to people still choosing not to get the vaccine?
Yeah, anecdotally, I haven't. I know here at the health system, we have frustration, but we also need to continue to give that message. Unfortunately, because there is such a large segment of the population, not just here, but in other areas, other metro and rural areas around the United States, and especially those hard-hit regions. We do continue to have concern. We do have frustration. All of that is kind of balled in together because we know that these vaccines right now continue to be a miracle of modern science and medicine. To have these vaccines, which elicit very good immune responses to all of the variants that we have seen, they are life-saving and preventive measures that people still don't want to take for one reason or another. Whether it's politicized, unfortunately, because nobody should die for their political views, whether it's still feeling like it's an experiment, whether there's those misinformation campaigns about infertility, which are completely false. There are various reasons, but none of those reasons are good enough to override the general fact that these vaccines prevent you from going to the hospital, prevent severe illness, even in these young people, because we are seeing a lot of young people in the hospital that are unvaccinated and otherwise healthy. So these vaccines continue to be very good in preventing all of these things, and especially long haul syndrome. We know that long haulers can be up to 20 to 30% of patients who get any symptoms at all. There was a recent publication also that just showed, looking, I believe it was from England, that showed that even up to a year after having COVID, you can continue to have symptoms. So we know that can prevent. And also looking at those younger age groups, 12 and up, we know those kids can get long haul syndrome as well, and this can prevent that in them as well. So it continues to be vitally important. These vaccines are morbidity and mortality saving, illness and death saving. It is an easy measure to do, so we just continue to have to give that message as a health system, as a medical and science community.
Yeah, those long hauler stories are scary. We're going to be talking about those coming up here in the next following weeks. Okay, so the community, of course, is coming up their questions right now as we speak. So, Doc Hawk, we're going to get back to you in just a moment so you can answer those. So there is no question that the sun can cause cancer. So we've been told for years, decades really, to protect our skin with sunscreen. Now there's some rumor out there that sunscreens cause cancer. So get this. So an independent testing lab detected the chemical benzene, a known human carcinogen, in 78 sunscreen products, and is now calling on the Food and Drug Administration to recall those. The lab is also calling on the FDA to set a limit for benzene levels in sunscreen and for exposure in a single day. The FDA is reviewing this complaint. Now, since benzene wasn't found in most of the sunscreens that were tested, but 78, the company says that using it is not unavoidable, but that any detectable amount of the chemical should not be allowed. So we want to bring in Medical Director of Dermatology, Anand Rajpara, to help us kind of sort all this out. Now, this claim, of course, is not suggesting that people not wear sunscreen. You would never tell anyone that. But what should really the takeaway be from this information and some of these recent studies that we've been talking about?
Yeah, I'm glad we're talking about this. It's I think a lot of people probably saw in the news last night that Johnson & Johnson actually recalled 5 of their spray sunscreens that were contaminated with benzene. So it's definitely a frightening headline, especially for parents who are, slathering their kiddos in sunscreen all over. The main takeaway message is that sunscreens are still safe and effective. This is not a sunscreen problem. This is a manufacturing problem where the minority of the sunscreens tested were found to be contaminated with benzene. Benzene is not a sunscreen ingredient. It's never been a sunscreen ingredient, and it definitely should not be in there. Fortunately, the majority of the sunscreens tested were safe and did not have benzene. And again, this is a manufacturing problem. It actually just recently happened with hand sanitizers, you might have seen. Several brands were recalled for benzene contamination as well.
So is benzene called anything else when you're looking at the ingredients? Because I will tell you, I read your email to me yesterday, and you said that you and your wife had to throw out some sunscreen.
Correct.
I've got a huge bag of sunscreen, and I just grab what's ever in there and start spraying hosing my kids down with it. But I read your email. I went straight to the drugstore, and I actually, for the first time, turned the bottle around instead of reading the pretty picture on the front, and was looking for benzene, and I didn't find any, so I grabbed 3 of them. If it doesn't say benzene on there, is it a safe to go ahead and purchase?
So that's a great question. So benzene is not a sunscreen ingredient, so it won't be listed on any sunscreen. It's just in there accidentally as a contaminant.
Oh, okay.
So the only way to really know is to check the lab that tested it is Valisure. They have on their website, they have a list of the sunscreens that tested positive for benzene. So if you have any of those sunscreens that are on the list, we recommend you throw those out immediately. And you can get a sunscreen. They also have a safe list on there. So benzene you won't find on the ingredients.
Okay, so they're not going to admit to having that on the list of ingredients.
It should not be
but I thought
in
that
there.
they sneak it in there because some of the levels are low enough that it's safe. I mean, we hear a lot about that. Something's in there because it's at a safe level.
And it's confusing because a lot of the sunscreen ingredients, especially in chemical sunscreens, will be like oxybenzone, avobenzone. Those should not be confused with benzene.
Okay, because I did see that.
Yes.
Okay, so I was like, oh, I got to call Dr. Rajpara. I still got to make sure these are okay. All right, so we wanted to find out if folks in our community are protecting their skin. In today's morning rounds, we talk with a few folks who spend a whole lot of time in the sun. Take a listen. Got it.
With 3 kids, we try to apply it before we leave the house. Otherwise, it doesn't get applied, or the kids jump in the pool.
I do not wear sunscreen.
Why?
I get really, it blocks all my pores, and I get really sweaty, and it's just uncomfortable.
We were always told that sunscreen was not for African Americans. The sunscreen was for Caucasian people, so we never used sunscreen at all.
Definitely shaded areas, long sleeves, long pants if you can, and sunscreen.
And even when you're young, start when you're young, and keep doing it when you're older. You can start and should start as young as you can.
Did your mom harp on you when you were young?
Yes, she did. Yep.
She lathered you up good?
All good, ears and everything, until I was white.
Since a young age, my mom has always put sunscreen on me, and every time I come to the pool, she's always like, "Gotta put your sunscreen on. You don't want to get skin damage like I have, Dylan. Come on."
I'm a swim coach. I also teach swim lessons, so I'm out from 8 in the morning to 12 or 1 in the afternoon, and I've got to at least, get my shoulders and my face because I will get burnt.
I became more knowledgeable about the importance of wearing sunscreen and how much it protects your skin, and so I do try to be avid and make sure we put it on the kiddos.
I don't ever remember wearing sunscreen as a kid. I don't know if it's an 80s, 90s thing.
We go to the dermatologist quite often and don't want to find spots, and so she said sunscreen up good and go for it.
All right, Dr. Rajpara, kind of a mixed bag of answers. It seems like young people are getting the message. Do you think we've moved the needle, though, in letting people realize that when you protect your skin, you're also protecting yourself against potential cancer?
Yeah, I think definitely a lot of the younger people that I see are more aware of how important it is to wear sunscreen, not only for skin cancer prevention, but it also keeps you looking young, keeps your skin from developing wrinkles and sun damage. So you'll notice that people that do excellent sun protection from when they're younger usually look, 5 to 10 years younger than their age.
All right, so clear it up. Any type of sunscreen, even on that list, is it better than no sunscreen at all?
Yes, so absolutely. We definitely recommend wearing sunscreen over no sunscreen. We know for a fact, sunscreen has proven benefits of skin cancer prevention, preventing collagen breakdown of the skin, wrinkles and sun damage, and preventing sunburns. So, the ingredient that was found in the contaminated list, the benzene, it is a carcinogen. So obviously we want to avoid it. So don't use anything on that list.
So there's other products out there to use.
Yeah, there's plenty of safe products you can get from the safe list. Whether you want to use chemical-based or mineral-based sunscreen, I'm fine with either one, whichever one you're willing to use most often. Just
in case people are just joining us, I want you just to kind of reiterate what Johnson & Johnson did, because like you said, it's not about a sunscreen, it's about the company recognizing that they needed to get these products off the shelves. What does that say, that they're doing that?
Yeah, exactly. So it's actually a good thing. It means that there's people out there who are watching our sunscreen products and testing them for quality and safety. It's a good thing that they did detect these low levels of benzene in these spray products and are going to recall them for safety measures. The FDA will look into it. They'll fix the manufacturing process and make sure that going forward the sunscreens are all safe and do not contain benzene.
Because you don't want to discourage people from using a sunscreen ever.
Correct. Yeah. You should always wear sunscreen. Absolutely.
Okay, we're going to get to community questions here in just a second. A couple more questions for you. What's the number one question that your patients ask you when they come in?
The number one question they ask me is what sunscreen I recommend, because there's so many to pick from, so many different SPFs. There's chemical-based, mineral-based. So I get asked that pretty much every day.
Can you reveal it? What is it?
For me personally, I like to use an SPF 30 plus tinted mineral-based sunscreen. So the mineral-based sunscreens are zinc, titanium dioxide. They sit on the top of the skin and reflect sun, so they're not absorbed into the skin. So they cause less irritation, less allergy. They're better for acne-prone skin. They're better for people who deal with hyperpigmentation and melasma.
So mineral-based, it's always a go. That's always good.
Yeah.
And just touch on the studies that have been out about people, that it can absorb into the skin. We just don't know if that's harmful or not.
Exactly. So for the chemical-based sunscreens, they've done some studies on that recently, and they found that the ingredients in the chemical sunscreens, like oxybenzone, are actually absorbed into the bloodstream and are detectable. We have no idea if that's harmful. It's just that we just know at this point it's absorbed. So the FDA is actually evaluating that as well, but there's no evidence that is currently harmful.
I don't know if I like all this, because I'm going to go home today and I'm going to lather my kids up head to toe with stuff I don't know is harmful. I don't know what's in it, but we still do it every day. I'm sure all parents out there do it. So, but again, if we're talking cancer, we're protecting. And just lastly, who watching right now should be coming in for an annual body check that maybe hasn't done it in the past? I mean, we know people who are high risk. I'm high risk. I come in every year, but maybe there's somebody sitting at home going, should I not?
Exactly. So anyone that has a history of, multiple sunburns, blistering sunburns, we know that increases your risk of melanoma by 50%. Anyone with a first-degree relative who has a family history of melanoma, we know that doubles your risk, so they should be coming in. And people with lots of moles, if you have more than 50 moles, you're at increased risk, so you should get checked out.
And then just quick myth bust from that mama who is swinging her kid out there. Are people with darker skin or olive-colored skin or African-American skin, are they exempt from having to wear sunscreen? Let's lay that to rest.
Yep, so we definitely recommend sunscreen still. Although people with skin of color are at reduced risk of skin cancer, the other damaging effects of sun as far as aging and hyperpigmentation still apply. And we know that in people with skin of color, when they do develop melanoma, it's usually detected later and with a worse prognosis. So we definitely recommend sunscreen for people.
Okay, great info today. All right, so as promised, we want to get back to our community questions. We know, Jill, they've gotten many of them, so I'll let you get us started.
Okay, good morning. And I just want to shout out to Dylan and his mom in that video. I say the same thing to my daughter. My parents didn't put sunscreen on me. And I just keep telling my daughter, you don't want to look like this. You don't want to have this problem.
Stop it.
At my age. Yeah. Kylie says that her dermatologist says the same thing as Dr. Rajpara about zinc oxide. So a clarifying question that I have for Kylie, to tag on to Kylie, is, when you say mineral, do you mean zinc oxide, and why tinted?
That's a great question. Yeah, so mineral means zinc or titanium, either one. Those are both the mineral-based sunscreens. Tinted is actually great for a couple of reasons. One is that it blocks visible light. And visible light is kind of what can make hyperpigmentation from acne, or, a lot of women deal with hyperpigmentation of the cheeks and of the forehead, known as melasma. And then also it also is less likely to leave that kind of white residue, especially, for people with skin of color. The tinted sunscreens tend to blend in better.
Okay, and Mary says, when did sunscreen become widely available to the public without a prescription?
So, yeah, the sunscreen has always been an over-the-counter product as far as we go back. The FDA has been regulating it more, and actually we'll have new recommendations in the fall regarding safety. Right now, the only products that the FDA deemed safe and effective are the mineral sunscreens, so zinc and titanium, that's typically what I recommend.
Are there sunscreens out there that you get by prescription? Is there something that kicks it up a notch?
There are no prescription sunscreens available. They're all over the counter.
Mm-hmm. All right. And Isaac said, and now we're going to segue into the COVID questions. Isaac says, will the J&J sunscreen recall turn people off from getting the vaccine made by the same company?
Oh, that's a good question.
That is a good question. I mean, I believe that, people that are already unwilling to get the vaccine will kind of latch on to any type of information, whether it's real or not, to kind of strengthen their views. So unfortunately, I feel like this, this kind of information, which is important to talk about it and debunk the myths, so it can't be used kind of to further solidify their positions against, sunscreen or vaccines.
Yeah, I would completely agree with that. I think that is a great point. Lots of losing the forest for the trees in these, and grabbing on to certain maybe inconsequential or unrelated types of numbers or points. A big one is, well, it's experimental, it's not fully approved yet. Once it is, I'll get it then. Likely there is still going to be a change to another reason at that point in time. So I think, just to your point, Dr. Rajpara, that's exactly right. And I think there will continue to be in a lot of people. Now, we have seen some vaccine hesitant people who have gone ahead and got the vaccine. A recent publication did show that some of those fence sitters did go and get the vaccine. So there will be that number that does go to get the vaccine, but there's also going to be those that other vaccine hesitant or obstinate group who will still continue to look for reasons not to get the vaccine for one reason or another.
Do vaccinated people spread the virus?
You know, from the earliest data that we've had, and good data, although small numbers of people, it did show that you had less viral replication, therefore less expression of virus out into the community. So we felt that transmission of the virus for those fully vaccinated people was significantly reduced, 90% or more. Now, obviously, we have talk of Delta variant, and maybe it's more transmissible. Still don't understand exactly what that means. Again, is it more fit because you replicate more of it, so you're expressing more into the environment? Do you replicate it longer? Are there other components of that virus that help reduce your immune response? We just don't know those questions yet. So I think those questions are being asked and investigated, but we don't have the full answer to that right now.
So that may be the answer to the follow-up that this person had on their question. They said, so why do vaccinated people ever need to wear a mask?
Yeah.
I think you just probably answered that because we don't know.
Yeah, I think we don't know. But again, the earliest data from fully vaccinated people in looking at that question specifically did show a significant reduction in your ability to transmit the virus if you are fully vaccinated. That comes from experimental studies, but also real-world studies. And I think, you know, the Delta, it has taken over. It is still fairly new, but I would expect more of those questions to be asked and answered, and more research publications out, you know, fairly soon about that.
Okay, Elizabeth asks, I am allergic to the flu vaccine, and I have been advised I would be at high risk for reaction to the COVID vaccine. Do you agree? What are your thoughts?
You know, I don't, but again, we're talking about your individual health. I'm not sure who told you that. Was it a general practitioner? Are you seeing an allergy specialist? Right now, the only contraindication to getting any of these COVID vaccines is if you had a reaction to a COVID vaccine. Again, influenza vaccines are created differently. The vast majority of them are created in a vastly different manner than any of these COVID vaccines. So my initial answer is going to say, no, that should not affect your ability to get the COVID vaccine, but I would talk with your medical professional about that. Again, just because really the only contraindication to getting a COVID vaccine is if you've had a reaction to a COVID vaccine or any of those components in there. But the influenza vaccine manufacturing process is vastly different than any of these. So again, my initial answer is no, but as an individual, please talk with your medical professional about that.
Gretchen is asking, are the patients that we have in the hospital now mostly from the metro, or are they mostly being transferred in?
Yeah, I haven't seen the numbers from today as far as that goes, but earlier in the week, we had only 2 that were transferred in from outside of the metro area. The rest of those patients were from the metro area or from our normal catchment area. But again, we've had more. Now we are a busy hospital. We are seeing people for those quote unquote normal medical issues, heart attack, stroke, other types of infections, other types of medical problems as well. So we do have a very high census right now, and so we do continue to take transfer calls. It just depends on what we have the ability to take based on that. But from what I can tell you from our earliest numbers in the week, we had only really had 2 transfers in for COVID itself from some of those other areas.
So Jean says, thank you, Dr. Hawkinson, for the details on the vaccinated and especially for putting them on the screen where they can see it. He has 2 thoughtful questions. One of them is, do you have anyone fully vaccinated with no comorbidities?
We do not. All of our fully vaccinated people do have significant comorbidities. Again, those comorbidities are obesity, diabetes, heart disease, lung disease, hematologic malignancy, meaning like a blood cancer, other types of immunosuppression as well. We do not have any fully vaccinated people with no other health problems that are in the hospital at this point.
And his second question is, do the comorbidities, such as high blood pressure and obesity, prevent the development of antibodies?
You know, we haven't seen that particularly, but for things like obesity or the heart disease, lung disease, you are already at a natural state of not being in optimal normal health. And so sometimes when you do have the COVID-19, you can have, you can be tipped over, and some of those other issues can become more exaggerated and more of a problem or an issue. But as far as we know, there's not really a significant issue with developing antibodies. But again, we're looking at antibody response for that immune response, but we're also looking at the T cell response, and that is what creates that full immune response to SARS-CoV-2, but also a full immune response to really any other infection that you'll be encountered with.
Janet says, I'm so confused. Wasn't the vaccine supposed to help the ones with the health problems, and that's why they were the first ones to get the vaccine? Yeah. Also, with the breakthrough of fully vaccinated people, could that be a reason that some people still don't want to get vaccinated?
I think so the vaccine was never going to prevent 100% of people going to the hospital or having severe illness. What it does is, again, significantly reduce that whole spectrum of disease, but it especially protects those most vulnerable patients. And that's what we have seen, and that's what we have talked about as well. Who are the patients that we aren't seeing in the hospital? It is those nursing home patients that, in that community that was devastated so much early on in the pandemic, in those patients that were in those nursing homes. So I think that, understanding that it isn't 100%. And we saw this in the trials, and this is consistent with the trials as well. It isn't 100%. It does significantly decrease your chance of having those problems, and we have seen that, and we saw that early on since the vaccine has been given. But again, now we have those behavioral aspects of the disease. And by behavioral aspects, I mean there are no restrictions. There are no mask mandates. People are meeting together, gathering together, indoors, outdoors, in large groups. And so you continue to have spread of the disease, and as your total numbers of spread get more and more, that population that gets ill and needs to seek hospitalization, that population will grow and more as well by just the pure numbers of infections. So I think seeing these patients with vaccination coming to the hospital by no way should make people think, well, I'm not going to get the vaccine because I'm still going to get ill. That is backward thinking. That is not the purpose of the vaccine. The purpose of the vaccine is and has been to overall decrease the spectrum of disease of COVID-19 and significantly reduce your individual chance of going to the hospital, having severe disease and death. And that's exactly what we're seeing from this. So I think just understanding that even some fully vaccinated people are going to the hospital should not reduce somebody's ability and need or want to get the vaccine. If you've seen reports from other areas such as Springfield, or I saw a report from somewhere in California today, all of the patients they have in the hospital are unvaccinated. So I think that is the important takeaway message.
That's got to be so, here I am going to kind of weigh in, but that's got to be a little bit disheartening or even to healthcare professionals, because I hear you say all the time, and and Dr. Rajpara was saying it's preventable.
Yep. Yeah, and to Dr. Rajpara's point earlier, there is some segment of the population which will latch on to any little number or any little tidbit of information and expand that to be the generality of, well, see, this happened, so I am not going to get the vaccine. And again, I think that's a myopic view. That is not taking account the whole body of work about the vaccines, about the disease process itself, and especially about understanding that these vaccines do significantly reduce your individual chance of going to the hospital, severe disease, and death, still, even with Delta variant out there.
Okay, so we have time for about 2, maybe 3 questions. Michelle wants to know, she said, my mom received the COVID vaccines during chemotherapy. Is there research regarding effectiveness of the vaccines during chemo?
That's a great question. We just had a publication of, and the KU Cancer Center, the Hematologic Malignancies Group, the Bone Marrow Transplant Group, just recently had a publication accepted that looks at those immunosuppressed populations and during chemotherapy. And what we do know is that for a large group of those people that were getting chemotherapy or are immunosuppressed, they do not have optimal antibody and T cell responses. Now, a lot of that depends on what stage of chemo are you in, when exactly did you get the vaccine, what is the immunosuppression that you're getting. So to that point, that is very important, that people who are immunosuppressed for one reason or another continue to do those other non-pharmaceutical interventions like masking and distancing and trying to avoid indoor spaces at this point in time. And even Dr. Stites has talked about that even with his lung transplant patients. They regularly continue to wear masks. So I think taking those other non-pharmaceutical interventions and doing those on a regular basis, especially given now the prevalence of the disease itself and Delta variant, it is probably a good thing to do at this point in time until we can really nail down what is going on, what are the trends in the next 2 weeks. Can we see a decrease, hopefully, rather than an increase? It will be important to continue to do those non-pharmaceutical interventions, even if you got vaccinated.
Julie wants to know, is Addison's disease considered a comorbidity?
You know, at this point in time, I think we've had that question in the past. At this point in time, we wouldn't consider that really a comorbidity if it's managed well. Certainly not to the extent of obesity and diabetes and heart disease and lung disease.
Okay. Oh my God, they're really coming in. You guys heard me say there's only time for a couple of more questions, so now you're sending them. If I don't get to these, we will do these tomorrow. Promise, right, Jess?
Yes, we got it.
Okay, so Judy says, come again. Does obesity itself affect the immune response to the vaccine?
You know, we haven't seen that. I think in the past there has looked at other vaccine and response in obese patients, but overall, what we would say is no, it doesn't affect that. Again, what are you looking at? Most of the research out there looks at antibody levels, but we know antibody levels are not the only thing and not the only correlate of protection. So there hasn't been any specific research, I believe, with obesity. There has been some research with some other vaccination, probably influenza vaccine as well. But overall, obesity itself is just a state of inflammation. So your body is already not working properly as far as the immune response goes, and that is why you are at risk of infection, not only COVID-19 but other infections as well. And it goes all the way down to the molecular level of just your ability to metabolize and have extra glucose and things of that nature in your body, really down to the molecular level. But as far as antibody levels themselves, I would say no. But again, we also do not understand the full correlate of protection or the actual antibody level that gives you protection. It's just in general, obesity is a state of inflammation. It does put you at risk for infection in general, complications in general, and again, that goes all the way down to the organ and molecular and cellular level, just due to the disease, diabetes itself, or obesity.
Yeah. Okay, so Ann says, I have to confess, the number of vaccinated folks you have worries me. Mm-hmm. With 17% of your patients vaccinated and about half of the population vaccinated, it would seem that the vaccine is only 66% effective against a severe disease. She wants to know if she thinks that we're getting more people because we're tertiary. You know, we take the sick to the sick. You want to help with the math?
Yeah, I would caution you on that math, what you're looking at. I would have to do it. I can't do it right now on the spur of the moment. But I would caution you on that. Again, I think the vast majority of people that we're seeing coming to the hospital are unvaccinated. As far as the percent of the population that's vaccinated and the people that we're getting, still, I don't believe it would reach 66%. We haven't seen that in real-world experience. Again, in the Scottish and the UK data, that would not bear out to that type of significance or that level of effectiveness. The level of effectiveness, what we've seen in the published studies, continues to be 90% or more in saving people from hospitalization and severe disease if they are vaccinated. So I think that needs to continue to be the take-home point. I wouldn't be worried or concerned. What I would be more concerned about is that segment of the population, and sometimes, depending on what community you're in, that large segment of the population that still does not want to get vaccinated. Because that will overall, number one, help you as an individual, protect you from severe disease and hospitalization and long COVID, but that will also help the community in the fact that we still believe that you are going to be able to transmit the disease less when you're vaccinated, even with the Delta variant.
Yeah, and I did an interview with Dr. Stites recently with CNN, and one of the things he said to the reporter really sticks out in my mind. He said, you have to understand, these are really, really sick people. These are the kind of people that, and he said that one of the patients, if they would have eaten a bag of potato chips, that could have resulted in them having to come into the hospital to be checked out because they're so sick and their ability to breathe. He goes, these are people that are really, really, really sick.
Yeah.
And so he just really wanted to drive that home. And Neil gets our last question.
Yeah.
He says, and hi, Neil, thanks for watching. My favorite myth is that the hospitals are making more money on COVID patients. Can you speak to this one?
Yeah, I mean, that's completely false. Again, the hospitals don't make more. Nobody's making more money. I can't speak really to the business end like that, but we have addressed this. Dr. Stites has addressed this in the past. There is no truth to that myth. When you have really, really sick patients in, yeah, you bill a certain amount. But think of all the time and the resources that are used, that it's hard to recoup those costs. And it's not about the cost. It's about saving that patient's life and making their quality of life better, getting it back to where they get home and get with their family and loved ones. So the short answer is no, there's absolutely no truth to that. Dr. Stites had addressed that really early on in the pandemic as well. Again, one more misinformation campaign that has been out there. But we have to continue to answer these questions. We are here, the health system is here to treat you, to treat your loved ones, to get you back out of the hospital, and again, get you back to a good quality of life. There's no truth to the hospitals or the physicians making more money because of COVID-19.
Okay. I've got more, but I'm saving it for tomorrow.
Okay, that's what I said. We will get to those great questions on Follow Up Friday. Let's get our final thoughts from Dr. Rajpara. What do you want us all to head out in the sun and know today?
So I would definitely say that we still believe sunscreen is safe and effective at preventing skin cancer, preventing skin aging. I definitely urge people to look on the Balasher website just to make sure their sunscreen doesn't have benzene in it. If it does, throw it out. If you were using a benzene-contaminated sunscreen, I know a lot of my patients have messaged me worried. Don't panic, don't freak out. We actually get low levels of benzene exposure every day in the air we breathe from car exhaust and cigarette smoke and gasoline and fossil fuels. So it's nothing to panic about. Just switch to a safe sunscreen and you'll be fine.
Don't freak out. That's good advice. They get that. Also, really quick, aerosol, is that good? Because you're spraying that around your kids' faces. Is that okay?
Yeah, we actually don't like the aerosol sprays as much because you can inhale it. It can exacerbate asthma. And actually, the majority of the sunscreens that had the benzene in them were chemical sprays.
All right, I got to head back to I kept my receipts, and I got to take all those back. All right, good advice. Thank you so much. All right, Dr. Hawkinson, final thoughts from you.
Yeah, I was going to say, in regards to one of the earlier questions, what's the most common question you get? I would say probably from your friends and family, it's, hey, doc, I got this rash. But, being serious here, we have a lot of questions and concerns about the numbers and the fully vaccinated. Again, the vaccines that we have are really miracles of modern science and medicine. We know how well and how significantly they protect every individual. Even if you are immunosuppressed, it is still reducing your chance of going to the hospital, having severe disease and death. We need to continue to talk about vaccination because they are safe. It is not experimental. They do not cause infertility. There are a number of myths out there. We need to continue to combat those because the way that we are going to stop the spread, hopefully the Kansas City metro area will not turn into what we've seen in Springfield and earlier on in the pandemic in California, in Detroit, in Chicago. We can stop this. We can significantly decrease the amount of spread, decrease the amount of people coming to the hospital, if we continue to have people get vaccinated. And that is the main story here, despite any little details or any figments of news that people may pick up to try and make it seem as if the vaccines do not work and are not safe. That is absolutely not true. They continue to be safe, and they continue to be extremely effective in preventing that whole spectrum of disease from COVID-19.
All right, great information. All right, Dr. Hawkinson,
Yes.
our friend
Yeah.
here at the show. We just want to offer our condolences for losing your grandmother.
Yeah.
I'd like you just to take a couple of minutes and share with us about the lovely Miss Stella.
Yeah, so my grandma, Stella Hawkinson, she was a great matriarch for the family. My last living grandparent was with us for 98 years and passed away peacefully on Monday night. You know, really was otherwise healthy. She got through COVID, did not get COVID, was in a nursing facility. They did a very good job. But really that isolation did not help. And we've heard about that, you know, isolation during the pandemic, not only for nursing home residents, but for a lot of the public in general. But just a great mother, a great grandmother. That is a picture there from, I think, 1976.
Is that baby Dana?
Yeah. So I was young at that point, but you know, we have prayers for her. She's in a much better place now. She's surrounded by love and some of our other family members. Well, I think it's all good.
All right. Well, this show's for you, Stella. Thank you for sharing about that. I'm glad you're getting home to see your family.
Yeah, and my daughter is actually, her birth date is the same as Stella's, so that's a very good thing.
Carry on the legacy.
Yes.
All right. Thanks for sharing that. And thank you for being with us today. Tomorrow we are back with Follow-Up Fridays. So Dr. Kevin Ault, he's the man. He serves on the National Advisory Committee on Immunization Practice. So we're going to hear more on how the CDC puts together the vaccine policy for the United States. And also, Dr. Seitz, he's joining me back here on the desk. That's tomorrow. Have a great Thursday.